breastfeeding mother at Bwizibwera Health Center IV, Mbarara District. She is a resident of Bwizibwera Town Council, Rwanyamahembe Sub-County, about 27 kilometers northwest of Mbarara Town, the largest town in western Uganda. Katushabe had turned up to seek solutions to her one-week-old son, who had difficulties in breastfeeding, and health workers had found it difficult to find a solution.
Omwana wange akabata kuonka kulungi obuwena achekere beta abasawo bantu bankonyire hati nindo atandikire kolaki kuhinduka.
Midwives at this center sought the knowledge of a mobile application developed by Ugandan scientists to diagnose diseases in babies aged 0 to 28 days, known as the Protecting Remote Infants by SMS, in brief PRISMS. The application is currently being used at Bwizibwera Health Center IV, where midwives use phones to get a diagnosis. The application comes with a form where a health worker enters all the findings, including a sick baby's age, weight and heart rate, among other essential details.
This is the patient number, it was 001. Now the response is the weight was normal, the respiration is normal, the color and capillary refill all are normal, so and jaundice they are all normal. And this is a term baby. Because the heart rate we had 162, which is high. So they say the heart rate is fast. Now they say look for the cause. So here I click, it will bring you the management of what you're supposed to do for this fast heart rate. So everything is there.
The phone application was invented in 2013 to empower frontline health workers such as midwives, nurses and birth attendants with knowledge and information on how to handle neonatal health cases. At Kunda Trifonia, a midwife at the facility was among the 3 midwives that carried out a pilot study on the application, working on 4 babies each, totaling to 12. The health center is among the 14 centers where the application is piloted.
We are privileged.
Atkunda says since they started using the application, the number of infants referred for further treatment at Mbarara Regional Referral Hospital has reduced.
Our babies are managed from here. We refer when the reply of the PRISMS show you that you do this management, which we are not having at this place.
In Uganda, the death rate in newborn babies is still high, with the Minister of Health reports indicating that Uganda's neonatal mortality rate is approximately 29 deaths per 1,000 live births. Mbarara District Health Officer Dr. Peter Sebutinde says the application has reduced neonatal deaths by 30%.
We have also seen a 30% reduction of infant mortality and neonatal mortality in this health facility. We have seen a reduction of the complications from mothers. We have seen reduction over 25% reduction in maternal mortality.
The first 4 weeks of life, also known as the neonatal period, represent the most vulnerable time for a child's survival, according to World Health Organization, especially in areas where there are few specialists. Dr. Sebutinde says the application is solving a problem of the limited number of specialists. To manage sick neonates, a team of health researchers from Mbarara University of Science and Technology came up with this mobile application in 2013 due to a limited number of health workers to attend to these health cases, especially in rural areas. The researchers behind the application include Dr. Data Santario, Dr. Francis Bajunire, and Martin Mukama, under the CamTech invented PRISMS.
This app is affordable. The only cost facilities will incur will be the maintenance costs to keep the phone charged, to keep the phone, because it is web-based, so you need the internet to maintain this app. Otherwise, the app is applicable. So our appeal is that this application should be popularized.
The Minister for State in charge of primary health care, Dr. Joyce Moriku Kaduchu, says government is more than willing to support such innovations to improve maternal and neonatal health.
Yes, we are going to support it. We want it to be presented in a senior top meeting, and then we disseminate it and we see how it can be supported. As long as it is to improve the health of the mother and the baby, as government will support that.
midwives and other health workers credit the application for improving their knowledge, but want neonatal care at lower health facilities like this one streamlined.
If we could get adequate space, when a baby is sick, is transferred with the mother in a different a room for proper care.
The application is an addition to the already existing applications in the country aimed at improving maternal, newborn and child survival in Uganda from the current 320 deaths per 100,000 live births to 70 deaths and below by the year 2030. Bernard Higa, UBC TV, Mbarara District.